Chair, ladies and gentlemen, I was delighted to be invited to the conference today and was also at the dinner last night. And I think the only mistake I made last night was to say that I'd never been in Belfast before, much to my shame, having been brought up near Glasgow. I've never been in Belfast, but did come from Edinburgh yesterday, and it is only 30 minutes by plane, so I will be back. And if your weather is always like this, but I know it actually isn't, because your weather's quite like our own in Scotland. And I was interested in the comment about how things are in Scotland, and I'll maybe hear a wee bit more, and if I can answer any questions about the good practice generally in Scotland about health and social care delivery. But today I'm going to speak about the Care Inspectorate. I've actually only been with the Care Inspectorate 2.5 years. Prior to that, you'll see in the notes of the contributors, was the Director of Social Work and Health in a local authority, so it's quite interesting then going into the regulatory body and have been until recently the Director of Inspection with the Care Inspectorate and now Executive Advisor to the Board. Doesn't that sound like a grand thing to be doing? Actually, I provide social work advice to the Board, and because I'm only 3 months away from my 60th birthday, I'm actually looking to kind of retiring soon and actually doing a particular piece of work around delayed discharge and actually looking at the new integration joint boards in Scotland and the work that health and social care are delivering, and some of the issues around addressing delayed discharge and the role that the Care Inspectorate can actually fulfil in assisting that process. But enough about me. You didn't really want to come along today to hear about me. Okay. So it is about participation and involvement, about delivery of human rights. And actually I was asked today to particularly talk about how we include the voices of older people in regulation and inspection. But I did want to start with a quote from our Chief Executive. Karen was appointed just earlier this year. And actually it says, and you can read the quote yourself, I'm not going to read it out to you, but really about the work of our inspectors, it's not just about looking at, there was reference earlier to minimum standards. We don't actually consider minimum standards as being important. Actually, we strive for excellence and actually expect organisations and services to be delivering excellence. But also our work isn't just about that, it's actually ensuring that people's rights are upheld, and there's clear evidence of that in the work that we actually undertake in our inspections. And I was asked to probably do 5 things in my 20 minutes, and you can tell me at the end if I've been successful. What I was asked to do was actually tell you about the Care Inspectorate, and I'm going to do that to give you a sense of the range of responsibilities that we have as the regulatory body in Scotland. Tell you about our engagement work with older people. I was specifically asked to refer to the legislative framework for that work, and I will, there's some interesting things in the legislation that set us up as an organisation. To tell you about our Involving People group and the use of inspection volunteers and the value of using volunteers in our inspections, and also what the challenges are that we have faced and face into the future with regard to ensuring that we hear the voices of people generally, but particularly older people. So who are we? We're Scotland's independent scrutiny and improvement body, and we're responsible for the regulation and inspection of care and support across Scotland, including criminal justice services, and also the scrutiny of social work services. Within the legislation, we have a responsibility to report on the quality of social work services across Scotland. And we also undertake joint inspections, strategic inspections of what we refer in Scotland as our community planning partnership. So we have a programme of inspections for adult services and also children's services, and particularly just now our programme of strategic inspections of adult services has a focus on older people and the quality of the work that the partnerships are actually doing to improve outcomes for older people. So we do have a responsibility to regulate services for people of all ages. And whilst those inspections are important, we're moving much more to an improvement agenda. In the past, perhaps, we've dwelt too much on the inspections themselves, and actually a fairly traditional approach at times where we've said this is where we think things are going wrong, but actually we're an independent body, we can't tell you how to improve. That's just a stupid kind of position to have, actually, that we tended not to be working with services to help them improve and identify improvements that could be made and actually work alongside those organisations, and we increasingly are doing that. We were established under the Public Services Reform Act in Scotland in 2010, and we were, in the legislation, we're SCISWAs. But actually too many people thought that was too much like TISWAS, that actually it changed. We are still SCISWAs, and that's Social Care and Social Work Improvement Scotland. That's our official title, but it was felt maybe a wee bit better to refer to ourselves as the Care Inspectorate. People were making fun of us. Well, I wasn't there at the time, and I wasn't making fun of them, but thought it was too much like TISWAs, but we're the Care Inspectorate. There are two general principles within that piece of legislation that are really important for us and tell you what we're about and what, obviously at the time, the Scottish Government felt was important to make a statement within the legislation. And I'm going to read them out. And the first one is that the safety and well-being of all persons who use or are eligible to use services are to be protected and enhanced. And secondly, the independence of those persons is to be promoted. Fundamentally stated within that piece of legislation that that's a responsibility we have as a scrutiny body. We are an NDPB, a non-departmental public body. We are independent from the Scottish Government. We're funded by them, so how independent are you? We're funded to them and accountable to the Scottish Government, but we try to operate independently, and certainly our work is independent. We have a very clear responsibility to report on the quality of services and then report that on to the Scottish Government. And where are we? Across Scotland, actually. We obviously deliver across Scotland. You'll see our headquarters is in Dundee in the east of Scotland. Our main Edinburgh office actually isn't in Edinburgh, it's in Musselburgh, nearby, and main offices in Aberdeen, Hamilton, Paisley, but offices across the country. You'll see in the Western Isles, Orkney and Shetland. I did go to Orkney, to our office there, on a visit, and was going to care services and turned up and there was no one there. We actually have 2 inspectors in Orkney and no admin staff, so I turned up at our office and was there for half an hour until the inspectors arrived. But some very small offices. We have about 600 staff, almost half of those are inspectors, and about half of those inspectors work from home. Home workers, because our services are delivered across the length and breadth of Scotland, and in any of the rural areas there will be nurseries for young children and so on. So our inspectors will work from home and access as easily as possible those services. That's our vision. Actually, I'm not going to read that out again, but I'm sure your organisations have very similar visions in terms of what we're about. But you'll see at the very end, it's about reflecting individual needs and promoting rights. It's very clearly stated in the vision of the Care Inspectorate and within our corporate plan. And it's to say what we do, we regulate and inspect services. There were 2 mistakes in this presentation. You no doubt saw the first one in Karen's quote, where I was reading basic, it says basis. And this one where I'm exaggerating the number of inspections that we actually carry out. We regulate about 14,000 care services across Scotland. An awful lot of those are childminders and also early year services, but about 14,000 care services used by, as I say, people of all ages. I'll tell you how we actually, the grading system that we use and the themes that we actually inspect against. 4 quality themes in every inspection: the quality of care and support, the quality of the environment, the quality of staffing, and the quality of management and leadership. Inspectors will be looking at all of those quality themes in each of our inspections. And we actually do evaluate on a 6-point scale. So we actually don't just start, we do have national standards in Scotland, and they're being reviewed at the moment actually by ourselves in Healthcare Improvement Scotland. And one of the principles of the review of those standards are that they must fundamentally be based on human rights. They are at the moment implicitly, but I think much more explicitly, actually be statements about human rights. But actually, our inspection work isn't just about meeting those standards and seeing them as minimal standards. We will evaluate services and actually then give grades on a 6-point scale from excellent, very good, good, adequate, weak and unsatisfactory. across each of those 4 themes, and actually will be very clear about the evidence that we can provide to actually show where they sit on those scales. So we have a methodology that sets that out and indicators for actually determining whether a service would be good, how it gets to very good and excellent. And I think that's where it comes to the fore in actually undertaking improvement work with organisations, that whilst we are evaluating on good, we need to be able to tell those services how do they achieve very good and how can they achieve excellence. So say we have 32 local authorities in Scotland where we look at the social work services and the inspections of the community planning partnerships. We do work with particularly in children's services with Education Scotland and Healthcare Improvement Scotland, and the adult side with Healthcare Improvement Scotland. We're also involved in prisons inspections with our colleagues in the Prison Inspectorate, and also in the children's inspections and the prison inspections with our colleagues in the Constabulary Police, the inspection body there. And these are all the services that we inspect. I'm sure you're familiar with them with your own inspectorate body here in Ireland, but a whole range of services, from adoption services, fostering family placement, a whole range of care homes across the age groups, and early year services, secure care for young people, a whole range of services that actually make up those 14,000 regulated services. Care service can't operate in Scotland. It's illegal if it's not registered with ourselves. And whilst we get funding from the government, we actually get a significant amount of our funding coming from the fees for the work that we undertake in terms of regulating those services. So it is our job to provide assurance and protection to the people who use services, their families and carers, and also the wider public, and actually to the Scottish ministers to give them assurance about the quality of services that are actually being delivered in Scotland. And as I say, an important part in improving services, to actually identify where there are improvements that are needed and how we can achieve those improvements by working alongside those service providers, and actually act as a catalyst for change and innovation, which we see as fundamentally important in our work, and promoting good practice. We probably about 15 months ago developed a website, The Hub it's called, where we will actually give examples of good practice from our regulatory work and inspection work, and people can actually access and see why are we grading something excellent. And we can actually set out why we think that particular aspect of the service is actually meeting that evaluation. And our values, I'm sure, again, like many organisations, these are fundamental to the work that we do, that will put people at the heart of everything that we do. We'll act fairly and be transparent and treat people equally. We'll be respectful in all that we do, and we'll be impartial and provide the best possible value for the work that we actually undertake. So let me move on to involvement and how that's developed over recent years in the work that we actually undertake, and including the voices of people in the work that we do. This is a quote from an inspector who said recently that we believe that our work is improved by the involvement of people who use services and their carers, and that they have a right to be involved in matters which affect their lives. Of course they do. Of course they do, but it was interesting the inspector is actually saying that, and that's how they're going about their work. And they want to ensure, as they're undertaking the inspections, that actually they do get the views of people who are using those services. We actually also have a legislative requirement to do that. And again, it's in the Public Services Reform Act 2010, Section 112. It's a duty of user focus. So as an organisation, we have a duty of user focus. That's how it's actually termed within the legislation. And what it says is that we need to secure continuous improvement in user focus in the exercise of our scrutiny functions. So that's something that we take obviously very seriously, as to how we make sure that people who use services are actually involved in our work, but also how are they involved in the services that actually they are receiving. And one thing that we've been absolutely clear about recently is that in our evaluations of services, we want to see how people who use the services participate in the design and the delivery of the service and improving the services. And actually, if we're doing that, what we have to do is actually set high standards for ourselves. So we've been very clear about the standards that we set for participation in the work that we carry out ourselves. And as a result of that, we've had a recent involvement strategy, and it's just been refreshed, and it's now entitled Working Together, Improving Together. You'll find that on our website, actually, if you'd be interested in looking at that, and it sets out our commitment to actually how we will involve people in the work of the Care Inspectorate. And it's very clear, actually, that we need to do that and we want to do that. People are experts by experience. We may be experts, if you want to use that term, by profession, but people who use services are experts by experience, and we need to harness that experience and actually take it and look at how we, in our work, then give a sense of an evaluation of that service. And if we can get as many views as possible from the people who are using that service, then it will very much enhance the statements that we make about the quality of work that's being undertaken. So how do we involve people? We do that in several ways. So we start off with the board of the Care Inspectorate. We have a board, as I say, we're independent but accountable to the government, but we have a board of 12 members, and at least two, probably should be more, but at least two have to be someone who uses the care service or is a carer of someone who uses the care service. At the moment, we have more than two, but that's where we start with our involvement with people who use service, with actually being on the board of our organisation. We then have an involving people group. Actually, that's a group that has representatives from people across Scotland. At the moment, we have about 50 members, and they're involved in a whole range of activities, consulting in the work that we're doing. At the moment, we're reviewing the methodology of our work, and very important that our involving people group are actually included in that. These are people who use services or are carers of people who use services. They also have played a very, very important part in the past 3 years, actually, and can continue to do so in the recruitment of our inspectors. They'll be involved in that recruitment process, and also in any senior member of staff who's appointed to the Care Inspectorate. Our involving people group will be involved in that recruitment process, and indeed we're involved in the recruitment of our chief executive, and they're involved in project work and consultation. But our inspection volunteers is another important way. We have at the moment 68 inspection volunteers. We are recruiting for more. We have 25 in training at the moment. The inspection volunteers have become crucial members of the inspection team that go in to inspect services. We will obviously train them before they go in. They will shadow inspections before they actually go out on the inspections themselves. They have access to report writing guidance. They will participate in the inspections by speaking to individuals who are in the care service. They will speak to relatives. They'll attend focus groups. They actually will then include and write their own report about their own experience of inspecting the service, and that report will be included in the overall report from the inspector, which then becomes a public document. An important part that the inspection volunteers can fulfill is actually being able to spend more time with people who are using the service, to actually observe practice within particularly care homes. And we found what can be very valuable is actually them observing meal times, just to see what goes on, the interactions that happen at meal times, and also other interactions within the care service. So where are we within inspection volunteers? Year before this, so 2013-14, they were involved in about 500 inspections. This past year, 14-15, involved in 593 inspections. Now, last year we actually completed 7,818 inspections. That's a lot of inspections, but actually an awful lot of those were childminders and in early year services. So they actually are involved in what you could say is a relatively small number of our inspections, but actually 64% of those 593 were inspections in care homes, and particularly care homes for older people. So that's actually about a third of the care homes for older people that inspection volunteers were involved in, and get really valuable information about the older people who are actually using those care home services. To a lesser extent in care at home services, but it's an area that we want to improve, because the value of care at home services is that they can speak to the people who are using the care at home service. They don't have to go to the person's home necessarily, but can actually get good information over the phone from care at home services. But really valuable information from the care home services for older people. You'll see they spoke with 4,364 people in those inspections. You know, our inspectors are able to do that to an extent, but because of the time constraints, they will never get to those number of people in terms of actually getting their views, and over 1,300 carers. And the time that they could actually commit to that was over 4,000 hours. Real value that actually is added to our reports and our inspection process. So say 68 active inspectors. In the first quarter of this year, You might not believe this, but we generally have a slow start to our inspection year for various reasons, actually. So they're continuing to be involved. As I say, the numbers the same as last year, but we have 25 in training at the moment, and we do want to kind of increase that number. Our challenges, we have involvement outcomes listed in our involvement strategy. Those are our challenges. I realise that the time's probably moving on, and I'm not going to read those out to you, but please access our website where you'll see our involvement strategy and what our outcomes are that we want to achieve by improving the way that we include people in our work. But actually, one of the important things that actually has come, and something Lindsay said at the end of her presentation, we recently reviewed the first 3 years of the Care Inspectorate and produced a report which is entitled our Triennial Review, snappy title, which was a review of all of our work that we've undertaken across 2011 to 14. It's an interesting read, actually, because it actually looks at all of our regulatory work across those 3 years and looks at the trends of how things have actually changed over that period of time. Very positive news generally is that actually the services are improving, the quality of services are improving. One fundamentally important thing is that there's a very, very strong correlation between the level of participation and the quality of services. I know that seems a very obvious thing to say, but actually we have the evidence across those 3 years of all of the regulatory work. So across those 3 years, we will have inspected practically all of those 14,000 care services, and there's a clear correlation between the quality of participation and the quality of service provision. Thank you.